So it's with great pleasure we move out to the country and see what happens when we have an expert in Australian vaccidial diseases coming from down south. So welcome, Professor Stephen R. Welcome.
Thanks very much, and I'm pleased to be here to talk about something a little bit off the main agenda, I guess. Not a lot of people know a lot about Q fever, and so I'm really delighted to be here to be able to tell you a little bit about it. There's a lot to discuss in the half an hour I've got, and I'm a little bit behind time when I start. So I'm going to go fairly fast, but I'm going to cover the main points. And I do want to particularly cover the issue of vaccination, because that's very important. That's obviously what you're most interested in. And you'll just be interested in that picture there. That's me sitting there taking it easy while the chap in the background's doing all the hard work with the vaccinated guinea pigs. So Q fever is an infectious disease. It's transmitted from animals to humans. That means by definition it's a zoonosis. It's caused by a bacterium, not a virus. Okay, bacterium, Coxiella burnetii. And it's actually quite common in rural and regional Australia. It's quite difficult to diagnose by the doctor as it has no unique feature. There's nothing that the patient comes in and you say, ha, you've got Q fever. Just doesn't happen. However, it's relatively easy to treat if you make the correct diagnosis and you use the correct antibiotic, not the usual antibiotics, but the correct antibiotic. And it can be prevented with QVAX vaccination, which is a very good vaccine. And I'll talk a little more about that later, obviously. And we are the only country in the world to have a Q fever vaccine. Who gets Q fever? Q fever is an infection of occupation, people who are associated with animals, usually in association with their work, like, people working on farms or in stockyards or abattoirs, or stock truck drivers, and people that are involved with animals for their hobbies. And there's also a disease of location, people living in rural and regional parts of the world, not just Australia, the world. And so this is not a disease that GPs in cities see very often, hardly ever, in fact. In fact, my GP doesn't even know about Q fever. So now in Australia, the incidence varies from state to state, and Queensland is the hot spot with New South Wales #2. And as you can see from this map, the highest incidence is actually in southern Queensland, southwest Queensland, and northern New South Wales, where there are not a lot of people living there, but the actual incidence, the risk of getting Q fever, is actually very high because there are a lot of animals there. And the animals, the microbe passes out into the environment from the animals, lives in the dust, and gets blown around in the air. So you can just inhale it and be literally miles away from an animal. So let me tell you a little bit about the disease, because it's not covered very strongly in medical school, I have to say. There are several presentations. Probably the most common one is the asymptomatic seroconversion, where a person inhales the microbe, an infection is established, but their immune system deals with it and they don't notice any illness at all, but they seroconvert. So they go from antibody negative to antibody positive. So if you should happen to check them, you probably won't because they're not sick. But if you did that, you'd see seroconversion. And that's how we do epidemiological studies. So in northern New South Wales, I did a study in Guyra, for example. Over 20% of people are antibody positive, but not 20% of the people that came down with Q fever. So that's quite common, asymptomatic seroconversion. Then there's acute Q fever, the actual illness, the main illness, which I'll talk about. Then there's chronic Q fever, which is a serious but minor form of the illness, and is really a sort of due to a focal persistent bacterium living in the patient after the initial infection. Then there's the post-Q fever fatigue syndrome, which I'd like to point out sometimes occurs after bacterial infections as well as viral. And then, of course, the past-Q fever, where the patient's immune and won't get infected again, because infection gives you good immunity, like the vaccine, I might add. So this is Australian data, and not from overseas, but essentially if a person in Australia is exposed to Q fever, or Coxiella burnetii, I should say, about 20% of them are asymptomatic, they seroconvert and they develop immunity. So no problem, they don't even know they've been exposed. But about 80% will come down with acute Q fever, which is not a pleasant illness. Of those people, 88%, roughly say 90% to take home message, recover and develop immunity. A very small percentage, 2%, go on to get chronic Q fever, which is a persisting foci of replicating bacteria in some part of their body, and that can be a very serious infection. And then 10 to 15% go on to develop post-Q fever fatigue syndrome, which is not unlike long COVID and post-infectious fatigue. So there's asymptomatic seroconversion. In the Meredith outbreak on the goat farm, it was 20%. In the Netherlands, the big outbreak in the Netherlands, there were actually 4,000 cases which came from infected goats. But when the Dutch authorities did a sero survey in the areas, they found that 40,000 people had actually been infected. So 90% of them were asymptomatic. And of course, normally you don't know what it is, because unless you test the normal people, because if you only test the sick people, you're going to get a very biased figure. Now, acute Q fever, it actually presents as a very sharp onset, a flu-like illness. The patient's well one day and sick as a dog the next. Fever is the main feature, and the respiratory symptoms may be mild, actually. It might be just a bit of a cough or something like that. Sometimes the patient doesn't even mention the cough, but the doctor notices that they're coughing a little bit. There's no pathognomic feature, so I don't think it says this is Q fever. And if you don't ask about what the person does for a job, or where they live, or what sort of hobbies they got, or do they have any animal contact, you'll probably miss the diagnosis. Apart from fever, there's muscle pain, headaches, hepatitis, or that's usually just a chemical hepatitis rather than a obvious clinical hepatitis. A joint pain, and the fatigue. The acute fatigue is very severe. You know, when farmers are hardworking people, as I'm sure you know, and they'll get out in the farm no matter what, because they've got to do a job, but they just fall apart. They just have to give up. And after about 3 days of that, they come to see the doctor. So it's a very severe acute fatigue, not chronic fatigue, acute fatigue. And there are loads of rarer manifestations, which, in fact, Q fever can present as almost anything. And a lot of doctors misdiagnose it as an autoimmune disease. And of course, that gives them immunosuppression and they get worse. If a person develops chronic Q fever, this is the most dangerous form. I should say in acute Q fever, there's only about a 1% risk of you dying. So it's not really a dangerous disease. It's just very debilitating. But chronic Q fever is actually a dangerous disease. It occurs months to years after the initial infection, and the initial infection might have actually been mild or asymptomatic. So in the big Dutch outbreak, there were people coming to the doctor years after the outbreak with chronic Q fever who'd never presented initially. They weren't sick enough. And when the doctor goes, "Did you have Q fever several years ago?" They go, "Don't think so, I was fine." So sometimes they just present with chronic Q fever. And as I say, this is due to the persistence of a foci of viable, growing Coxiella bonnetti somewhere in the patient's body, probably in the immune system. And this is due to the immune system not adequately destroying them all at the initial exposure, or sometimes due to inadequate antibiotic therapy, but usually due to a patient who's not been treated because they didn't get sick or they weren't sick enough, and the immune system hasn't quite got on top of the microbes, and they're still there. Clinical features are usually a very gradual onset. It takes months and months, usually, sometimes years, before the diagnosis of chronic Q fever is made, because the patient's just gradually getting sicker and sicker. And they go to the doctor, and the doctor has a lot of trouble working out what's wrong with them. Eventually, when the diagnosis of chronic Q fever is made, most of the patients actually have an endocarditis. The cardiac valves are failing, which means that they develop cardiac failure. And of course, that's quite a serious illness. And often chronic Q fever has to be dealt with cardiovascular surgeons, because they will need valve replacements, particularly the aortic valve, and they need long-term therapy as well. 18 months to 2 years of doxycycline and hydroxychloroquine. And even then, sometimes it doesn't work. So not a nice disease. Vasculitis can occur in a whole variety of arteries, but particularly if there's an aneurysm, that's a weakness in the cell wall, or if there's a vascular prosthesis present. So it seems to damage the endothelium, and the bacteria like growing in that damaged foci. So vasculitis, and probably, I suppose, with adequate treatment, the mortality rate in chronic Q fever is still about 20%. And with adequate treatment, without treatment, it's almost 100%. So it is not a nice disease. Children whose parents run stations and they're exposed to infected cattle and sheep and that often come down with the osteomyelitis, and that's quite nasty, quite difficult to treat, or a discitis. And of course, there's also a hepatitis associated with it. And if you do a biopsy of the liver, you'll see a particular granulomatous pattern in the hepatitis. And then finally, the post-Q fever fatigue syndrome. And it's quite interesting. People talk a lot about, post-infectious fatigue syndromes now because they're well recognised, and it does occur in Q fever. Initially, people said, oh, no, that's just poo-poo. But now it's been shown in every country of the world, really, and about 10 to 15% of people who get infected with Coxiella bonnetti do come down with this post-infectious fatigue syndrome. And it's just like a bit like all the others. We don't know what causes it. It's obviously an immunological disorder. We've examined some of these patients and they do not have viable Coxiella bonnetti anywhere. We've taken bone marrow samples from them. We've taken biopsy samples from them. We've taken surgically removed valves from them and put them all into highly sensitive SCID mice, which will respond to one viable Coxiella bonnetti, and none of the mice get sick. So they don't have viable organisms in them. So it's no point treating them with antibiotics. It's an immunological disorder, but we don't know much more about it than that. And people get over it. The best thing to say is, you'll get over it, mate. Just hang in there. Great medical advice. By the way, I bought Bill. It is very debilitating though, because it knocks people around, and and it occurs in people who are hardworking, conscientious, want to get on with their life, And it's not like the chronic classic chronic fatigue syndrome patient that we sometimes see that just never gets better and you don't know when it started. This starts after they've had Q fever. So look, I could speak for ages about the laboratory diagnosis of Q fever. This is my area of specialty, but you're very pleased to hear I've only got one slide on it. And that is because I know you're not interested in it that much. But essentially, there's two tests. There's the PCR test, the polymerase chain reaction, and there's the serology test, which is the measure for antibodies, okay? In the first week of the illness, you go for PCR. You send EDTA blood to the laboratory, and there's a period of a couple of days right at the beginning of the infection when the bacterium, not a virus, the bacterium's in the bloodstream, and you take blood, you send it to the lab, they'll be able to detect the DNA from Coxiella bonnetti. And that's a positive PCR result, and you can believe it. However, if you get a negative PCR result, don't be misled, because it can be a false negative. Because if it's just dropped below the detection level, and you take your blood sample here, it's going to be negative, but the patient's still got Q fever. So you can believe a positive PCR, you can't believe a negative PCR. And at that stage, the immune system hasn't had time to react to produce antibodies. So the serology will be negative. So if you only do serology, the lab test will come back negative for Q fever. You'll make the wrong diagnosis. So better to order PCR and serology. In the second week of the illness, one can be positive, the other can be positive, or they can both be positive. There's a bit of an overlap. Sometimes there's a bit of a gap. So it just varies. And in the third week, the PCR is always negative because it's falling below detection level, but the antibodies are up. So the serology is positive. So my recommendation, the take-home message, just order both, simpler. PCR, serology, Q fever, thank you. And that's all I'm going to say about lab diagnosis. Prevention, now this is what I know you're most interested in. So you can prevent Q fever, but it's tricky. You can reduce your exposure to infected and carrier animals and contaminated environments, but you've got to work for a living. Gee, if you work in an abattoir or a cattle yard or something, it's easy to say, well, don't work there anymore, but maybe, you can't get another job. So that's not that easy to do. You can wear an N95 mask, which is just great in the laboratory that's air conditioned and everything's just hanky-dory. But if you imagine working in laboratoires in an N95 laboratory, they put them on when the supervisor appears, and as soon as the supervisor goes, they take them off again. So they're useless, really, in a workplace situation. The only thing that's really good to prevent Q fever is vaccination. Vaccination against Q fever with QVax. Now, QVax is a whole cell killed vaccine. So it's killed. There's no way in the world you can get Q fever from QVax, but you can get side effects, though, but you can't get Q fever from it. And it's the whole cell, it means the whole bacterium, everything in that bacterium is actually going into the patient's immune system. And that's why it has quite a lot of bad side effects to it. So, but it's a good vaccine. It's actually made from an Italian strain of Coxiella bonnetti, isolated from a soldier in Italy in 1945. and it protects really well in Australia. So that's a good Australian-Italian connection. It's made by Seqirus, CSL here in Melbourne, and Emmy's here somewhere. Where are you, Emmy?
Outside the room.
She's outside the room. Okay, I was going to tell you who she was so you could go and ask her about it. But it's been available in Australia since 1989, so we've had quite a few years of experience with it. It's a very good vaccine, 95 to 99% protection. You hardly ever hear of anyone that's been vaccinated that get Q fever. There's 10 documented cases of vaccine failure after 20 years of use in Victoria. So that's to give you a rough idea. It's a 0.5 ml subcutaneous injection, very easy injection. It's got 25 micrograms of the whole cell. There's no adjuvant in it, okay, because it doesn't need an adjuvant because the other bacterial components are their own adjuvant. Immunity takes 2 weeks to develop, however. So if someone's having a vaccine for a work-related situation, you must tell them, don't expose yourself for 2 weeks. So you've got to ask the boss for a job in the office or don't start working for 2 weeks. I've seen several cases where people have been so anxious to get paid, or the company's been so anxious to get someone working that they get this shot and they're immediately exposed. And of course, they've got a good chance of coming down with Q fever. And it's not a vaccine failure at all because they haven't allowed the time for the vaccine to actually stimulate the immune system to produce the actual immunity. Now, if you've never been exposed to Coxiella burnetii in your life, Qvax is a very safe vaccine, very good. But a lot of people have, because from time to time we get exposed to animals and we get exposed to air that's coming from animals we breathe in, and some of those animals are excreting Coxiella burnetii. So many people, and more in rural areas, not so many here like in the heart of Sydney, but many people have been exposed. And if you give the vaccine to those people, they have got a high probability of having a nasty side effect. So what we do, and this is what makes the vaccine difficult, is you have to screen the patient. So a week before you're going to give the patient the vaccine, you do a skin test, which is an intradermal injection of 0.1 of an ml of diluted skin test reagent. And you've got to dilute it yourself, unfortunately. It's a 1 in 15 dilution. And then you send the patient off for an antibody test to the local pathology service. And unfortunately, you can get false positives and false negatives with the serology result and the blood and the skin test results as well. I've seen both. So you can't always rely on it. But anyway, the policy is if the serology is positive, don't vaccinate. But sometimes the serology is a false positive and the patient doesn't get vaccinated and then they come down with Q fever. If there's a positive skin test, you don't vaccinate. And sometimes it can be a false positive as well. And there's been a few cases just recently in Queensland where people have not been vaccinated because they had what was thought to be a positive skin test, start working at the local abattoirs and they come down with Q fever. However, if you've got negative serology and negative skin test, that's when you vaccinate, okay? So I think it's fair to say that Qvax is a much more difficult vaccine to use compared to most other vaccines. So there's, even when you do all the skin testing and the blood testing and everything, there's still a whole range of side effects and adverse events that occur. But as has been said many times in this meeting, it's much better. The adverse effect from the vaccine is much better than the disease Q fever, because that can be very, very debilitating. So I just want to indulge myself for a few moments to tell you about a new vaccine that we're developing. I'm the medical director of the Australian Cancer Reference Laboratory, and in association with Deakin University and the New South Wales Department of Primary Industries, we're working to produce a new human vaccine against Q fever. And this new human vaccine is not a whole cell. It's just a bit of the bacterial cell. It's the cell wall polysaccharide, like what they call the O antigen. And so it's a purified polysaccharide. Everything else is taken out of the vaccine. Okay, so it's just that. And to enhance the immunogenicity, we chemically link it to a protein, the tetanus toxoid. So it's actually very, very similar to the meningococcal vaccine, the pneumococcal vaccine, and the Haemophilus influenzae vaccine. And it works really well in guinea pigs. I've only done guinea pigs so far, so sorry, this is only guinea pig data. But you can see the vaccine, the curve on these is all guinea pigs. On the left, you can see the temperatures of the guinea pig. The unvaccinated ones in black, they go up. So these animals well, the unvaccinated ones weren't vaccinated, of course, but the vaccinated ones had their vaccine, 40 microgram subcutaneously with alum adjuvant, only one dose, and waited for a month for immunity to develop. Then they were infected with 10 to the 6 Coxiella burnetii, virulent Coxiella burnetii up their nose. And you can see that ones that were vaccinated had a much smaller rise in temperature, and that's actually statistically significant. And if you look on the other graph where we're looking at the weight change, you can see the unvaccinated guinea pigs got quite sick at about day 8, and their weight dropped right down. Some of them dropped down to about 20, they lose 20% of their body weight. They're that crook. Sitting in their cages looking really miserable. And I have to make sure the analytics people don't come around. And then, but the control ones that have been, but the ones that have been vaccinated, it's just a very, very small dip, as you can see. So average of 3.9 febrile days in the unvaccinated guinea pigs versus 0.7 febrile days in the vaccinated ones. So this, and we've done this experiment 7 times now, so we're very happy that it works. So what are we going to do next? Well, we're going to test the guinea pigs to see if 2 doses and 3 doses of vaccine gives them better protection. And I expect it will, because we know that's what happens with the human protein conjugate polysaccharide vaccines that are currently in use. And I'm also just about, next week, I'm about to do this experiment, test whether the vaccine is reactogenic in any pigs that are already immune. So we've got immune guinea pigs, and we'll put a little bit of the vaccine into them and see whether they have a bad reaction or not. Hopefully they don't. So will the vaccine provide protection in humans? Well, that I don't know yet. Has to be done. We need to have a phase 1 trial. We're still at the preclinical stages. I want to do a phase 1 trial next year if I can. The people that run these trials tell me it costs about $1 million. Can you believe that? $1 million. So if anyone's really, really wealthy and got a spare $1 million that they don't know what to do with, it's a very worthwhile project. We'll put your name on the paper. So I'm looking for funding, and I'll probably finish up doing the study in Queensland, because that's the state with the highest incidence of Q fever. And then, of course, it'll go through all the other stages. So you can't challenge humans, so we have to test it in an area where there's a high endemic Q fever level, so somewhere in probably southern Queensland. But so there'll be several years yet before the vaccine's available, even assuming that it's safe in humans, and that's what the phase 1 trial will tell. I expect it will be, but obviously it's got to be tested, and we won't know for several years whether it's actually effective or not, because you just have to follow these patients through and see. So watch this space. So thank you very much for your attention. And there was funding for this project from DMTC, which stands for the Defence Medical Technology Corporation. I think that's what it stands for. But their funding is just about coming to an end now, so we're looking for more funding. If you've got any questions, I'm happy to answer them. Yes, that's correct. 1 dose, never give a second dose, because they'll have a reaction to it, you see. Well, how do you know? Because people that have QVAX are working in rural areas, and they're getting exposed all the time to subclinical doses of Coxiella burnetii. So I suspect they're being boosted by natural infection. But it appears to be a lifetime protection, actually.
You mentioned about the Q fever and how this comes after inadequate treatment. Is there any way of testing for inadequate treatment?
No, unfortunately, there's not. Most of the cases of Q fever are people who haven't been treated. But if the patient was to be given, say, the wrong antibiotic, and they just got better by natural causes, then the Coxiella burnetii could still stay there and be viable. So in experimental animals, you can take organ samples, and in humans, you could take bone marrow, for example, and see whether it's viable Coxiella burnetii there, but you don't do that routinely.
What's the first line treatment for Q fever?
Pardon?
What's the first line antibiotic treatment for Q fever?
Doxycycline. 2 weeks of doxycycline, 100 milligrams twice a day. And for Q fever, chronic Q fever, you should refer to an infectious disease specialist, because you often have to involve cardiothoracic surgeons and things like that. So I don't recommend GPs treat chronic Q fever.
Thank you, Stephen, for a very interesting talk. I'm just wondering, how does Q fever manifest in animals, and how do they catch Q fever? Do they inhale the bacterium, or they just wondering? Thank you.
Well,
Those online questions, similar things are endemic to the issue every.
All right, there's a sylvatic situation in most countries involving native animals and ticks. So it's a cycle between the native animals and the ticks. The ticks carry Coxiella bonnetti. And we had a few cases of patients getting Q fever from a tick bite, believe it or not. But most of them inhale it. So when the animal's infected, presumably by a tick bite, it infects the female, but when they're pregnant, the Coxiella bonnetti love growing in the placenta and the trophoblasts and things like that. So it's when the pregnant animal gives birth, that's when there's millions and millions of doses of Coxiella bonnetti come out into the environment. It's a spore-like form, so it lands on the dirt or blows in the farmer's face, whichever. Lands in the dirt, dries out, and then gets blown around. So there've been cases of from people living 5 kilometres downwind from a farm where sheep have been aborting. And so the main animal thing is reproductive failure. So abortions or failing to produce the normal number of offspring. So from a commercial point of view, the big outbreak in Meredith at the goat farm, their milk supply was going right down and things like that. So there is a financial issue. We're actually also making a goat vaccine because the goat vaccine that's available elsewhere in the world can't be imported into Australia. So we're doing that as another project.
Question here and then one over there.
You just mentioned the goat vaccine, so do farm animals get immunised against Q fever?
No, not currently. There's no vaccine in Australia that farm animals can be vaccinated against, but we're developing one. But it's initially for goats, but it'll probably work for other animals.
Hi, just because the Q fever vaccine register is no longer, because it's now recorded on the AIR, we're having a lot of trouble finding a Q fever provider because everyone's sort of dropped their details and their lists of providers for Q fever. So how do people find a Q fever provider? The truth of the matter is that any doctor can provide Q fever vaccination. You don't have to be a registered provider. The big problem at the moment is, well, apart from the fact that some doctors don't want to do it because it's a bit of a palaver, you know, the patient's got to come back exactly 7 days later, and the intradermal skin tests, you know, sometimes it's quite difficult to do. Sometimes the patients forget to come back and all sorts of things like that. But it is difficult. But the biggest problem is that CSL having production problems at the moment. So it's quite hard to get the vaccine. You've got to have a patient who really badly needs it, and you've got to sort of phone up and sweet talk them into letting you have it.
Question here.
Thank you for the talk. So human doesn't keep Q fever from the tick bite?
Well, we have seen a few, but it's not the main way. The main way is by inhalation of infectious material from infected parturient mammals such as cattle, sheep, and goats. But also from kangaroos. There's been cases from kangaroos as well.
Second question is because in Sydney metropolitan area, sometimes during the season, we see at least 3 or 4 cases of tick bites, kids, adults, and parents are just really concerned about the type of infection they can get from tick bites. Yes,
the most likely thing you'll get from a tick bite is actually not Q fever, it's rickettsia infection. And don't get me started on that because that's a subject I love. But there is a rickettsia in several of the Australian ticks. The main one, Ixodes holocyclus, which lives along the east coast of Australia, likes biting people. And a significant proportion, 10%, contain the rickettsia australis or rickettsia honii, and people come down with a fever, headache, rash, muscle pains, but you can treat it with doxycycline as well.
So in the corner there, and after we'll be having a general discussion for any questions. But Stephen,
thank you, Lee. Look, I think talk about the funding for the vaccine and also the accessibility of the vaccine.
QVAX is made by Seqirus, and it's a commercial vaccine. It's not available on the national program, so patients have to pay for it. And when you add the cost of the vaccine, which I think is a bit over $100, the 2 doctor's visits, you know, because you've got to have the preliminary one, then the follow-up one, and the laboratory test to do the serology. There's no change from $300, maybe $350. So it's very expensive. So it's not for poor people, unfortunately.
You say that only one dose? The patient only needs 1 dose.
Only 1 dose, yeah. You don't never give a second dose. Only ever 1 dose of Qvax.
I feel like when we get the acute fever, we give doxycycline to treat it. So doxycycline not expensive. Then you get vaccine $300. So I ask this question to everyone. And I feel like it is only 2% of the patient with a chronic be beneficial for the vaccine prevention. Other people to get treated with doxycycline and that's
Sorry, I didn't catch your question.
vaccine effectiveness, right?
Oh, it's a very good vaccine.
Yes.
If you give it to someone,
What I'm saying is easy if someone has acute fever, we can treat with doxycycline.
Hmm.
And doxycycline is not expensive, less than $20. But vaccine is $300.
well, I don't know. I'm sorry, but I don't understand the question. Can you explain it to me?
It's cheaper to get sick than to be.
Is it cheaper to get sick than?
Sorry. If you've ever met anyone that's had Q fever, you'd know the answer to that is. They're as sick as a dog for a week to 10 days. And the answer is they willingly pay $3,000, not $300 not to have it. So it's much better to have the vaccine. And the only maybe not going to be in Sydney or Melbourne, but anywhere in rural regional area, definitely. Yeah.
Thank you.